Hi, this is Dr. Darrell. I wanted to tell you about a recent interaction I had with a patient. And what she wanted to discuss with me was about vitamin D because she had her blood work done, her vitamin D levels were low, and she's tried several different vitamin Ds and she got sick after them all. Like she knew right away, like after she would take them, like I don't, I don't feel good. I would feel not like different symptoms that will associate depending on which one she took. And I asked her, I said, hey, can you bring in what you have? And I looked at all of them, and they were all like, for vitamin D, there were like 7 different ingredients. Now, I'm not talking about doses and that's a whole new video. But like, they're all like 7, 8 different ingredients. A lot of them also too had soybean oil in. Now, typically, vitamin D is a fat soluble vitamin, so it has to be included with a fat. So pretty much any vitamin D supplement that you have, there's going to be a fat associated with it, whether it's extra virgin olive oil or coconut oil, which I don't see too often, or soybean oil. Soybean oil is obviously the cheapest. So if I see soybean oil and a lot of different ingredients, which are usually fillers, I know it's not a very good quality vitamin D. So what I told her to get, I said, hey, go to our Fullscript, our online dispensary, and get one that actually just has a couple ingredients in. I recommended her for the Protocol for Life. Protocol for Life, you have just the gel capsule, so it's a bovine gelatin and some glycerin that makes up the capsule, and then it's olive oil and vitamin D. Really simple, few ingredients. Now actually makes one that's very good as well too. Now this one here too, this vitamin D, this is 5,000 I use. It costs, I believe, like $15. I think the 2,000 cost about, and this is 120. I think the 2,000 costs, I believe, around $10 or $12. So sometimes I have people that, even though they want 2,000 a day, sometimes they'll take like a 5,000 every other day or 3 times a week. Saves them a little bit of money. So again, this is not about dosages because I can't tell you how much to take. I would have to see, okay, where are you on your blood work? How much time do you spend outside? My summer dosage is different than my winter dosage. So that varies as well too. So, so again, not talking about that, but if you're having some issues with taking a supplement, it may not be so much the actual ingredient inside, it may be also what's also surrounding it. So this patient, when she started taking the Protocol for Life vitamin D, she did great on it. So it didn't have all the other stuff in that wasn't helping her out. And I said this uses extra virgin olive oil as the fat, much easier on the body than soybean oil. So I thought you'd find that story interesting.